Hello everyone, my name is Kamal Kinani, and today I'll be presenting one of the most important topics in modern world that has potential to shape the work system and make the organizations function more effectively. This topic is conflict resolution. Generally, we're going to talk about international conflict resolution techniques, challenges, emerging technologies, and how AI shape the conflict resolution in modern era. Here we go. I'm going to share the screen. Yeah. International conflict resolution techniques, challenges, and emerging technologies. An exploration of mediation, misinformation, and artificial intelligence in modern conflict resolution. As introduction, international conflicts remain complex and multifaceted, involving political, economics, culture, and technological dimensions. Effective conflict resolution demands a combination of diplomacy, mediation, and innovative tools. In this presentation, we're going to explore um, the main topics, which is AI rule, third-party intervention, strategies for successful resolution, misinformation impacts, and mediation techniques. So let's start with mediation techniques in international conflicts. So we have facilitative mediation, evaluative mediation, and transformative mediation, and track one, track two diplomacy. I made a simple example for each tool, so we can understand how this tool could be used to solve conflicts. So let's start with facilitative mediation. A hospital mediator helps doctors and nurses talk calmly when they disagree about how to care for patients. That's mean. The mediator does not give solutions, but uh, helps both sides talk to understand each other. And that's what is called facilitative mediation. And here we come to evaluative mediation. That's when mediator provides legal policy expertise. Example, in a medical error case, a mediator who knows both the law and medicine explains how a court may decide and suggest possible fair solutions. Transformative mediation. Example, two healthcare teams who had many fights meet with a mediator who helps them to rebuild trust and communicate better so they can work together peacefully in the future. And track one, track two diplomacy. So track one, hospital bosses and staff unions meet to agree on work hours or pay. Track two, outside experts like patients, advocates meets with hospital staff to share ideas and improve patients' care. So an example on mediation techniques and how it could solve conflicts worldwide. What happened in during COVID-19 when the CDC helps many groups, drug companies, hospitals, states work together to get vaccines to people quickly. Rule of third-party intervention. There is mutual facilitation and mediation, arbitration, and peacekeeping forces and capacity building. And the same, we have been made a simple example to understand the role of each tool that we have. And starting with the neutral facilitation, uh, a hospital conflict resolution teams helps doctors and nurses talk openly after patient care mistakes, building trust, and better teamwork. Mediation and arbitration. Uh, Dispute between a doctor and hospital over contract terms goes to arbitration. A neutral expert reviews both sides and gives a final binding decision. Peacekeeping forces. During a hospital merger, a neutral outside team supervises daily works to make sure both old and new staff work peacefully and patients are safe. Capacity building. A public health program trains hospital staff in poor areas to improve care, manage resources, and handle future health crises better. During um, an example how third-party intervention um important and the role the third-party intervention plays during global health crisis like Ebola. World Health Organization helps countries coordinate treatments, supplies, and response. Strategies for successful conflict resolution. Building mutual trust, inclusive negotiations, power sharing agreement, long-term peace building, and monitoring compliance mechanisms. So, building mutual trust, error reporting system, example, just culture, encourage staff to report mistakes and building trust. Inclusive negotiation. Community health needs assignments involve all group in planning healthcare services. Power sharing agreements. Joint governments allows doctor, nurses, all patients to share decisions making. Long-term peace building. Program like Thrive Local address poverty, housing, and other health factors. Monitoring compliance mechanisms. The Joint Commissions audits hospitals to ensure quality and safety standards. Impact of misinformation and social media. Polarization and propaganda, disinformation, and undermining trust. Polarization, like an example for it, COVID-19 vaccine debates. Political and social polarization lead to strong divisions over vaccine mandates and public health measures. Propaganda disinformation. States and non-states actors manipulate narratives. Example, anti-vaccine misinformation combines online groups separate false information about vaccine safety, undermining public confidence in immunization program. Undermining trust. Public skepticism of negotiation processes. Example, mistrust in healthcare system. Example, like we mentioned in the resources, in Tusuki syphilis study. Tusuki syphilis study. The name is a little bit hard. Anyway, historical abuse have led to long standards mistrust among some communities, complicating a public health outreach and negotiations for care. Countering misinformation and promoting dialogue. Digital literacy combines and fact-checking initiatives, platforms accountability and dialogue platform and international cooperation. Digital literacy combines educate public on identifying false information, fact-checking initiatives, cooperation with independent organizations, a platform accountability, enforce stricter content moderation, dialogue platforms promote respectful evidence-based discussions. International cooperation share standards for information integrity. So here is like maybe one of the most important slides that we have today is the role of artificial intelligence in conflict resolution. Data analysis and predictive analytics, negotiation simulations, and mediation support tools. We also have an example for each tool that could use in healthcare. And let's start with data analysis. AI can analyze best data to identify conflict triggers by analyzing patient feedback, staff report, and clinical data to spot early sign of workplace conflict or patients' dissatisfaction. Example, AI tools analyzing electronic health records, EHR, to detect patterns of medical errors that may cause staff tensions. So we will go forward for each example, for the example of each one. So the time we have, it's not gonna help us to finish on time. So just to make it easier and we can understand it better. So predictive analytics. Example, AI predicting ICU capacity strains during COVID-19, allowing hospitals to take a preventive staffing measures. Negotiation simulation. AI models simulating nurse union contract negotiations to forecast salary impact and staffing levels. AI assist and mediation support tools, AI-powered patients portals helping resolve the billing disputes by explaining charts and offering solutions automatically. So ethical implication of AI in conflict resolution. AI may reflect existing biases in data. Privacy, patients' data could be exposed or misused. And transparency, AI decisions may lack explainability. Accountability. Um, Unclear who is responsible for AI errors. It's unclear if there is any um, errors happened in the system. So there is no clue we could know who is responsible for that. And consent, patients may not fully understand AI rules. So the conclusion of our presentation today is conflict resolution requires a blend of traditional diplomacy, inclusive strategies, and emerging technologies. Misinformation poses a serious challenge that demands collective actions. AI offers promising tools, but requires strong ethical frameworks. The future of healthcare conflict resolution depends on thoughtful integration of AI, ethics, and trust buildings, and inclusive decision makers. So that's all we have today. Thank you for listening. I hope you like this flower, the purple one. And I hope you uh, a nice day. And again, thank you for listening. That's all we have today. Bye bye.